So it's a subject that a lot of people don't want to talk about, but it's a medical conditioning affecting a lot of people.
Many may feel embarrassed or frustrated living with urinary incontinence. Today's community sponsor, Carl, urologist Dr. Uwas Zaid.
Yep.
I practiced, I promise.
So close.
He's got a little more insight here for us. So let's kind of get to the basics. What is urinary incontinence and who does it affect?
Yeah, absolutely. And you're 100% right. A lot of folks are just embarrassed to talk about it. They feel ashamed about it, or they don't realize there's a lot of options. But fundamentally, urinary incontinence is the involuntary loss of urine. It's, having a urinary accident. And a lot of things can cause it. And it affects a lot of folks, elderly folks, young folks, men, women, people who have surgery, who have not had surgery. But a lot of people are affected, and it affects a lot of people and causes a significant amount of discomfort.
How much leaking are we talking about? Is this just a little bit, or is this like losing all of it?
Yeah, great question. It's the gamut, right? Some folks have, they wear 1 pad per day, and it's a little quarter size amount. Some people are going through 7, 8, 9, 10 pads that just get saturated per day. So what really matters is the patient and how bothered they are by it, and that's kind of what drives our treatment goals for these folks.
It happens a lot to older, we perceive that it happens a lot to older people. Is it part of the aging process?
Yeah, it's a wonderful question. So some people assume that it's a natural part of aging, and that's just the way it is because, their grandparents had it, and, that's just the way it's been. That's not really entirely true, actually. So some medical conditions can cause urinary leakage, like bladder cancer, bladder stones.
Oh.
If you've had, surgery for prostate cancer, radiation, that can cause it as well. So scary things in your health can also cause it, too.
What about having a baby?
Absolutely. So that is one of the risk factors for developing coughing, sneezing, leakage is if you have children, the more children you have and the bigger kids you have too, certainly it can be a risk factor.
Well, me and trampolines don't get along. Just throwing it out there. I'm not embarrassed.
Yeah, well, and it happens, and that's one of the reasons we need to talk about this. So let's talk a little bit about telling people about how you talk about that. I mean, do you just... Who do you talk to?
Sure thing, yeah. I think the most important thing to realize is you're not alone, right? There's a lot of people in the United States and in the world who suffer from this, and it's a huge source for embarrassment for a lot of people. People can't go to church, they can't socialize, so that's the most important thing. And it's not a normal part of aging necessarily. And there's a lot of great resources. There's a lot of stuff on the internet, on our Carl website. We have a great amount of resources, but really your doctor is going to be your best resource, whether it's your...
It's a simple test, right?
Well,
to test for it or no?
It's more of it's a clinical examination, and it's just talking to somebody, it's asking people, look, do you leak urine? What triggers your leakage? Does it cause you bother in your life? And, it doesn't involve a lot of invasive, scary pokes and needles, not necessarily,
So if you can get over the embarrassment hump, there's actually someone can help you.
Exactly, 100%. And there's a lot of folks out there who are trained in dealing with urinary leakage. We have so many options for people that run the gamut from just talking about it and educating people about things maybe that you're drinking might be making your bladder angry. But there also are procedural options available for the patient if they're motivated.
Well, yeah, let's talk about some of those solutions because I think we have a list of those. As simple as changing your diet.
You're 100% right. So it depends on why somebody leaks. Some folks leak because they can't get to the bathroom in time. Some people leak when they cough or sneeze. So if you're one of those folks who can't make it to the bathroom in time, well, caffeine may not be your best friend. Neither might be alcohol. So just scaling back on some of those things. Spicy foods, acidic foods, certain types of fruits and vegetables can irritate your bladder.
Oh.
Yeah, so exactly.
But then I guess you could go extreme if you want to actually have an operation, a surgery.
Sure thing. So for the patients who have tried these less invasive means and they still have significant leakage, there's a lot of options. There's something called InterStim, which is like a bladder pacemaker procedure. Oh. We can even put Botox in people's bladders. Yep, exactly. We use it for wrinkles, migraines, and we can make the bladder look kind of pretty too. So.
Well, and the important part though is that that's what's helping to stop the leaks.
Exactly,
right?
100%.
You briefly, and we saw on the screen there, physical therapy. What kinds of therapies are this?
Yeah, that's a wonderful...
Are you talking about?
We're talking Kegels?
It's like Kegels on drugs, kind of. What it basically is you work with a specialized therapist who can help you target the specific muscles in your pelvis that control your urination. Because it's kind of tricky, when somebody says, oh, go do a Kegel, it's like, what does that mean, and how do I do that? Well, a lot of our therapists are very specialized in techniques that can help men and women focus on those muscles that are really important for bladder control. So and that's like a non-surgical way that can help a lot of people as well.
Lots of resources online, but you guys have resources, as you mentioned, at carl.org.
Absolutely, yep, exactly. If you go to carl.org and look at the urology webpage, there's a lot of resources there. And like I mentioned earlier, your primary care doctor is a great resource. Your urologist would be a great resource. And, this is something we see regularly, and this is something that's very normal for us to talk about, And
it should be okay to talk about it, just like we did here today. So thank you so much. Great
My
information.
pleasure. Thank you
Thanks,
so much.
Dr. Zaid.
I appreciate it. Thank you so
He
much.
gets carrot cake now.
Chicken and cake.
He did well. For more information, we'll connect you at CILiving.tv.